Welcome to the deep dive. Today we're getting straight into something really serious, something that every horse person needs to understand: equine anaphylaxis. This isn't just, a minor allergy. It's fast, it's potentially fatal.
Exactly.
So our mission today is to really pull out the essential insights from our sources, make sure you feel truly equipped to spot the signs and know about those critical rapid interventions.
And that's the key, isn't it? Recognizing it early and getting veterinary help fast. It sounds scary, and it is serious, but knowing what to look for and what happens next, that makes a huge difference.
Definitely.
We want to break down, what it is, why it's so critical, and crucially, what you need to do.
Okay, let's dive in then. Equine anaphylaxis. What exactly are we talking about? What is it at its core?
So fundamentally, it's the horse's immune system basically overreacting in a massive way. Think of it like a full-blown panic response to an allergen.
An allergen being.
Yeah.
Anything the body sees as foreign.
Pretty much, yeah. Something it's decided is a threat. And this isn't a slow buildup. It's a severe systemic, meaning whole body reaction that happens fast after exposure.
Right.
Technically, it's what we call a type of hypersensitivity reaction, mainly driven by these antibodies called IgE.
Okay.
Now, you might also hear about anaphylactoid reactions. They look clinically identical, really severe too, but the mechanism inside is slightly different. It's not IgE mediated.
Okay.
It doesn't require that prior sensitization. But honestly, from a treatment perspective, especially in an emergency, we tend to handle them very similarly.
So similar response needed. Got it.
Yeah.
When that internal alarm goes haywire, like you said, what's actually happening inside the horse? What's the physiological chaos?
Okay, so imagine the horse has encountered an allergen before, maybe a specific protein in a vaccine or an insect venom. The immune system makes those IgE antibodies.
Right, the ones you mentioned.
Exactly. And these IgE antibodies then latch onto the surface of specific immune cells, mainly mast cells and basophils. They're kind of like sentinels loaded and waiting.
Primed, basically.
Perfectly put. Primed.
Yeah.
Now, the next time the horse meets that same allergen, those waiting IgE antibodies grab onto it, and that binding action is the trigger.
Okay, it triggers what?
It triggers those mast cells and basophils to just degranulate. That means they dump their internal contents, a massive flood of potent chemicals, out into the system.
Chemicals like?
Histamine is the big one everyone knows, but also serotonin, prostaglandins, leukotrienes, a whole cocktail of inflammatory mediators.
Wow.
And this chemical storm causes chaos.
Yeah.
Widespread vasodilation, blood vessels everywhere just relax and widen.
So blood pressure plummets.
Dramatically.
Right.
And vessel permeability increases, so fluid leaks out of the bloodstream into the surrounding tissues. This combination leads to shock. The circulatory system just can't cope.
And other effects.
Oh, yeah. Smooth muscle contraction is another big one. Think airways clamping down, gut muscle spasming. It's a multi-system meltdown.
Complete system shutdown almost.
Mhm.
You mentioned shock organs. Where does this chemical storm hit the hardest in horses? What are we most worried about?
Good question. Horses seem particularly sensitive in a couple of key areas. The respiratory system is a major one.
Okay.
That smooth muscle contraction means bronchoconstriction. The airways narrow, making breathing incredibly difficult. You can also get swelling, edema in the larynx, the voice box area, further obstructing airflow, and even fluid in the lungs themselves, pulmonary edema.
Terrifying. And the other main area?
The gastrointestinal system, that gut spasm and edema in the intestinal wall, that translates directly to often severe colic.
So colic can be a sign of anaphylaxis.
Absolutely.
Right.
And often acute severe diarrhea, too. Then there's the cardiovascular system itself, suffering from that vasodilation and fluid loss we talked about, leading to shock.
Right.
And don't forget the skin. Hives, or urticaria, are very common, often one of the first signs. And angioedema, that sudden localized swelling, like a hugely swollen muzzle or eyelid.
Okay, so skin, lungs, gut, circulation. It really hits everywhere.
It can, yes. The hemic system, the blood itself, can also be involved.
So we know how it happens physiologically. But what actually triggers this? What are the common culprits horse owners really need to have on their radar?
Yeah, this is key practical information. The list is pretty broad, but some things pop up way more often.
Like what?
Historically, and still very common, are things that are injected. Vaccines are definitely on the list.
Okay, vaccines. Important to know.
Certain antibiotics, penicillin is a classic example, antitoxins like tetanus antitoxin, plasma transfusions, even some other common medications given by injection. So Anything going in via a needle is a potential trigger.
That seems like a really key point for owners to remember after any injection.
Be vigilant. Exactly. Insect stings and bites are another major category. Bees, wasps, fire ants, spiders.
Right, that makes sense.
Less common, but definitely possible, are food allergens. Maybe a specific ingredient or additive in feed.
Harder to pin down sometimes, I imagine.
Much harder, yes. And very rarely inhaled allergens. We've also seen reports implicating things like dewormers, certain vitamins, even some anesthetic drugs. The list is quite long.
Wow, okay. So, lots of potential triggers. Does that mean some horses are just unlucky? Or are certain horses more prone to this, like specific breeds or ages?
That's something researchers have looked at. Interestingly, we don't actually know the true prevalence, like how often it really happens overall. It's likely underreported. But we do have some data points. One study found allergic reactions at about 16% of blood transfusions.
16%, that's quite high.
It is significant, yeah. And maybe 6 to 10% of adverse drug reactions reported are classed as allergic. But as for who gets it, there's no clear link to a specific breed, sex, or age group being more susceptible.
So it could happen to any horse.
It seems that way. It appears more down to individual sensitivity, although there is some evidence linking higher levels of those IgE antibodies to certain genetic markers in the horse's immune system.
Ah, so a potential genetic component maybe.
Possibly, yes, suggesting some horses might just be genetically wired to have a more reactive immune system.
Interesting. What about general risk factors then, beyond potential genetics? Things owners can be mindful of?
Definitely. The biggest one is prior exposure. If a horse has encountered an allergen before, even if it didn't react badly then, it's now sensitized.
So the next time could be the bad one.
Exactly. And linked to that, any history of previous allergic reactions, even just mild hives after a shot, is a major red flag. Subsequent reactions can be much, much worse.
Right. That's crucial. Don't ignore mild reactions.
Absolutely not. Also, repeat injections of the same type of product, especially at higher doses, might increase the risk over time.
Okay, this is getting to the really critical part. The signs. What do owners, caretakers need to be watching for? Speed is everything, you said.
Yes, absolutely everything. The onset is usually fast. We're talking minutes, sometimes up to a few hours after exposure. And the signs can go from 0 to 60 very quickly.
So what does mild or moderate look like first?
Often, the very first thing you'll see is on the skin. Hives urticaria, these raised, defined welts.
Okay, welts. Anywhere.
It can be all over, or sometimes you see more localized swelling, that angioedema we mentioned. Puffy muzzle, swollen eyelids, maybe a swollen leg.
Right. And they're often really itchy. Pruritus. So the horse might be rubbing intensely, acting restless, agitated. That's an early sign of discomfort.
Okay, hives, swelling, itching, restlessness. That's mild to moderate. What about the severe end? The life-threatening signs.
This is anaphylactic shock. And these signs mean call the vet immediately. Emergency. You're seeing a systemic meltdown.
What does that look like?
Cardiovascular collapse. Shock. The heart rate skyrockets, often over 60, maybe even 120 beats per minute or more.
Wow, fast.
Very fast. But the pulse feels weak, thready, because the blood pressure is crashing.
Okay.
Check the gums, the mucous membranes. They might look pale, washed out due to poor blood flow. Or, confusingly, sometimes early on they can look brick red, congested because of all that vasodilation.
Pale or brick red. Got it.
Capillary refill time press on the gum. See how fast the color returns. It'll be slow. Longer than 2 seconds.
Okay.
Extremities, like ears and legs, often feel cold. Profuse sweating is really common in severe distress.
Sweating a lot. And then, the really scary part. Profound weakness. The horse might struggle to stand, wobble, or just collapse. Go down and stay down.
Collapse is a huge red flag.
Massive. Then there's respiratory distress. Difficulty breathing, dyspnea. You'll see flared nostrils, rapid breathing rate, tachypnea.
Labored breathing.
Yes, visibly labored. They might use their abdominal muscles to force air out, creating that heave line look along their flank.
Right.
If they're swelling around the larynx, you might hear a harsh, noisy sound when they breathe in, that stridor.
Like noisy breathing.
And inside the lungs, those constricted airways can cause wheezing. Or, if it's really severe, the lung sounds might actually be decreased because so little air is moving.
That sounds bad.
It is. In the worst cases, terminal stages, you might even see frothy discharge from the nostrils due to fluid in the lungs.
Oh, wow. What about the gut signs in severe cases?
You'll often see signs of severe colic, intense abdominal pain from those spasms and swelling.
Right, the colic again.
And acute severe diarrhea can happen. Sometimes increase gut sounds early on, but then things might shut down. Gastric reflux fluid backing up from the stomach can also occur.
So a whole range of severe signs.
Absolutely. And overall, profound depression, lethargy. If it progresses without treatment, collapse can lead to seizures and ultimately death.
Okay, that paints a really stark, clear picture. If you see any of those severe signs, collapse, severe breathing trouble, shock signs, it is absolutely time to act. Call the vet, no delay.
No delay whatsoever.
So you've seen the signs, the vet is racing over. How do they actually confirm it's anaphylaxis, especially when time is so critical? What's their diagnostic process like in that moment?
It's very much about rapid assessment and putting pieces together quickly. The diagnosis is primarily clinical, meaning it's based on recognizing those characteristic signs we just covered,
Right.
especially their sudden onset, and linking it temporally to a potential trigger exposure.
So the history you give the vet is vital.
Absolutely crucial. Did the horse just get a vaccine 5 minutes ago, half an hour ago? A new medication? Was it out in a field with known fire ants? That context is everything.
Okay.
Then, the immediate physical exam, checking heart rate, respiratory rate and effort, mucous membrane color, refill time, listening to the chest, looking for hives, swelling, assessing the overall state signs of shock.
And ruling things out too, I guess.
Exactly. Part of the quick assessment is differentiating it from other things that might look similar initially. Like, is it just a localized swelling at an injection site? That's common, but it's not systemic anaphylaxis.
Right, different problem.
Or there's a specific neurological reaction. Some horses get to procaine penicillin, they get hyperexcited, shaky, but that's not an allergic reaction, it's different. An accidental nick of the carotid artery during injection causes immediate severe neurological signs, like seizures again, different cause, different treatment. Or could it be severe colic from another cause, like a twist, or acute infectious colitis, or severe pneumonia? The vet is rapidly assessing all possibilities based on the full clinical picture.
Makes sense. What about lab tests? Can they run blood work to confirm it quickly?
In the immediate emergency, no. Lab tests just aren't fast enough. You need to treat based on the clinical signs now.
Okay, so treatment comes before lab results.
Absolutely. Later, if blood work is done, it might show things consistent with shock, like hemoconcentration, thick blood due to fluid loss.
Right.
Changes in white blood cells, electrolyte shifts, maybe elevated lactate indicating poor oxygen delivery to tissues, but that's usually assessed after stabilization starts or helps manage the ongoing case.
What about measuring histamine levels? Doesn't that prove it?
You can measure histamine or another marker called tryptase, but the results take too long to be useful for emergency decisions. It's more for retrospective confirmation or research.
Got it. Any other diagnostics used, like allergy testing?
Allergy testing, like skin testing, where you inject tiny amounts of suspected allergens, it's generally not practical or reliable for diagnosing an acute anaphylactic event. Plus, there's the risk of actually triggering a reaction.
Yeah, definitely don't want that.
Right. And sadly, sometimes the definitive diagnosis is made post-mortem based on characteristic changes found in the lungs or gut, but that's obviously not helpful in the moment.
Okay. So, clinical signs plus history equals rapid diagnosis and action, which leads us to the most important part, treatment. The vets arrived. They suspect anaphylaxis. What is the immediate critical action plan? What's goal number 1?
Goal number 1, 2, and 3 is basically act fast and aggressively. This is a life or death situation.
Okay.
The primary aims are to counteract those inflammatory mediators causing the chaos, restore cardiovascular stability, get that blood pressure up and circulation going, and support breathing, stop the cascade, and fix the immediate damage.
So what's the first thing they reach for? The absolute must-do.
Epinephrine, also known as adrenaline. This is the single most important drug. Full stop.
Why epinephrine specifically?
Because it's a physiological antagonist. It directly counteracts the worst effects. Its alpha-1 effects cause vasoconstriction, tightening blood vessels to raise blood pressure.
Okay, reverses the dilation.
Exactly. Its beta-1 effects boost heart rate and contractility, helping the heart pump better. And crucially, its beta-2 effects cause bronchodilation, opening up those constricted airways.
It's all the key problems.
Pretty much. It's the lifesaver.
How is it given?
Usually the first dose is given intramuscularly, IM, or subcutaneously, SC. It gets absorbed quickly that way.
Okay.
In really severe collapse, sometimes a diluted dose might be given very slowly intravenously. But IMSC is often preferred initially to avoid potential heart issues from a rapid IV bolus. The key is speed, give it immediately, even while still assessing.
Immediately. Got it. Can it be repeated?
Yes, definitely. If the signs don't improve or start to come back, it can be repeated every 5 to 15 minutes as needed.
Okay, epinephrine first. What's next? What else is critical right away?
Intravenous fluids. Massive amounts, given rapidly.
Why fluids?
Remember all that fluid leaking out of the blood vessels? That causes hypovolemic shock, basically not enough fluid volume in the circulation. Fluids combat that directly.
Okay, replace what's lost.
Exactly. The vet will start pumping in large volumes of isotonic crystalloids, things like lactated ringer solution or standard saline, usually as rapid boluses, maybe 10, 20 milliliters per kilogram of body weight over just 5-15 minutes, and repeat until perfusion improves. We're talking potentially very large volumes.
It's big volumes fast.
Yes. Sometimes they might also use synthetic colloids like starch, which help pull fluid back into the blood vessels, especially if the horse is losing a lot of protein. Or even hypertonic saline, that concentrated salt solution, for a rapid initial boost to circulation in adult horses in severe shock, followed by the crystalloids.
Okay, so epinephrine and aggressive IV fluids are the immediate 1-2 punch.
That's the core of the emergency response, yes. Stabilize first.
So once that initial crisis is hopefully getting under control with the epi and fluids, what other treatments come into play? What helps with recovery and preventing things from getting worse again?
Right. Once you've addressed the immediate life threats, you move to adjunctive therapies. Corticosteroids are really important here.
Steroids, like dexamethasone.
Exactly. Dex is common. They won't work instantly like epinephrine. Their onset is slower, but they're crucial for reducing the underlying inflammation, helping to stabilize those mast cells further, and importantly, preventing delayed or recurring reactions.
Preventing that second wave you mentioned earlier.
Yes, potentially helping prevent those biphasic reactions or just prolonged inflammation. So very important for the ongoing management.
Okay, steroids. What else?
Antihistamines. Drugs like diphenhydramine.
Makes sense to block the histamine.
Right. They help mop up some of the ongoing histamine effects, especially things like hives and itching. Usually given slowly IV, but only once the horse's cardiovascular system is more stable. You wouldn't give them first line in shock.
Okay, epi and fluids first, then maybe antihistamines.
Correct. And interestingly, while they help, they should be given separately from epinephrine, even though they can enhance some of its effects on blood vessels.
Got it. What if the breathing is still really bad?
If the bronchoconstriction isn't fully reversed by epinephrine, other bronchodilators might be used. Things like aminophyllene V or maybe inhaled albuterol via a nebulizer or mask.
And oxygen.
Absolutely. Oxygen supplementation via nasal cannula is vital if the horse is showing signs of respiratory distress or has pale bluish gums.
Okay. What about the gut issues, the colic?
For pain and also to combat potential endotoxemia from the gut being compromised, NSAIDs like flunixin miglumin are often used, but cautiously, especially if blood pressure is still low.
Right. NSAIDs can affect kidneys.
Exactly. If there's gastric reflux, the vet might pass a tube to decompress the stomach.
And if blood pressure still won't come up.
In cases of persistent hypotension, despite fluids and epinephrine, stronger vasopressors might be needed. Drugs like dobutamine, dopamine, norepinephrine, requiring intensive monitoring, often in a hospital setting as they carry risks like arrhythmias.
Okay, more intensive care options.
Yes. And if there's evidence of pulmonary edema, that fluid in the lungs, a diuretic like furosemide would be indicated to help pull that fluid off.
So a whole toolbox depending on how the horse responds.
Precisely. And throughout all this, constant monitoring is key. Rechecking vitals, frequently heart rate, respiratory effort, gum color, temperature, monitoring hydration, maybe repeating some blood work like PCBTP and lactate to see if the shock is resolving.
And watching for that relapse.
Critically important. Watching closely for any return of symptoms, that biphasic reaction, often for at least 12 to 24 hours after they seem stable. Vigilance is paramount.
Wow, what an intense process. It really highlights the need for immediate vet care.
Yeah.
So after all that, what's the outlook? What's the prognosis for a horse that's gone through this?
It's variable. The official word is usually guarded to good.
Guarded to good. What swings it one way or the other?
It really hinges on a few key things. How severe was the initial reaction? How quickly was it recognized? And most importantly, how fast and how aggressively was treatment started?
Speed.
Speed is life here.
Yeah.
Mild reactions, maybe just hives. They usually do very well with antihistamines, maybe some steroids. Good prognosis.
Okay.
Even severe reactions, if they get that epinephrine and fluid therapy immediately, have a reasonably good chance of survival.
That's encouraging.
It is. But if treatment is delayed, If the horse goes into profound shock or respiratory failure before help arrives or interventions start, the prognosis drops significantly, becomes guarded, even poor.
So time lost is potential outcome lost.
Tragically, yes. Delayed recognition or delayed treatment drastically increases the risk of death.
Okay. Which brings us to prevention. How can we try and stop this terrifying event from happening in the first place? What are the practical steps?
Prevention is obviously the ideal scenario, and there are definitely things owners and vets can do. Number one, keep meticulous records.
Records of everything.
Everything injected. Vaccines, medications, know the specific product name, even the batch number if possible. Keep a log.
Okay. Detailed records.
Number two, observe closely after injections, especially vaccines or anything the horse hasn't had before. Watch them for at least 30 to 60 minutes afterwards for any subtle signs.
Don't just turn them out immediately.
Right. If a horse does have a known history of allergic reactions, even mild ones.
Red flag, you said?
Big red flag. Talk to your vet. They might consider pre-medicating with antihistamines or corticosteroids before giving a potentially risky injection again. Or maybe choosing an alternative product entirely if one exists.
Pre-medication as an option.
Yes, sometimes warranted if avoidance isn't possible. For horses with known insect hypersensitivities, strict fly control, good sprays, fly sheets, masks becomes really important.
Environmental management.
Exactly. And a really crucial point. Always report any suspected allergic reaction to your vet, no matter how minor it seems.
Why is that so important?
Because that history informs future decisions. And remember, the next reaction could be the severe one. That mild case of hives is now a critical piece of information for that horse's future care.
Got it. Document and report everything.
Yes. In some cases, specific allergy testing, IgE testing, might help identify triggers to avoid. If a horse needs a drug they might react to, maybe consider alternatives, or if oral versus injectable is an option, oral might be safer.
Makes sense.
For horses with a known history of anaphylaxis, extreme caution is needed. They should be monitored very closely, maybe for 20-30 minutes, after any injection they haven't had before. For blood transfusions, cross-matching beforehand is standard practice to reduce reaction risk.
Cross-matching, okay.
And even for those non-allergic procaine penicillin reactions, things like not using the same injection site repeatedly, injecting slowly, and storing the drug properly can help reduce the chances.
Good practical tips. Are there complications to watch for after they survive anaphylaxis?
Yes, unfortunately. Recovery isn't always straightforward. Potential complications include things like laminitis.
Oh, founder.
Yes. Also, purpura hemorrhagica, which is another immune-mediated vascular issue. Severe ongoing edema, issues with red blood cells, or persistent gut problems like colitis can sometimes occur. So follow-up care and monitoring are still important even after the initial crisis.
What an incredibly intense deep dive. It just hammers home that speed of recognition and response.
Yeah.
That's really the game changer, isn't it?
Absolutely. It truly is. Understanding the signs, knowing those first critical steps, being able to give your vet that vital history quickly, it empowers you as a horse owner or caretaker.
Yeah.
It really highlights why vigilance and quick thinking are just so invaluable when it comes to managing your horse's health and potentially saving their life.
So thinking about everything we've covered, what really stands out to you listening? Maybe it's just how fast things can go wrong. Or maybe the fact that common things like vaccines can be triggers. Or perhaps seeing what shock actually looks like in a horse. Whatever it is, take that knowledge with you. Because being informed, truly informed, is always, always the first step towards being a prepared, responsible, and effective caretaker for your horse. Thank you for joining us on this deep dive.
Stay vigilant out there.